Hey everyone, today I'll be talking about venous disorders, and in this part I will be discussing about varicose veins. If I talk about varicose veins, it is defined as dilated and tortuous veins, as you can see in this diagram. Now, what you need to remember is that based on the diameter of dilatation, there are three terms. If the dilatation is less than 1 mm, it is known as telangiectasia. If it is between 1 to 3 mm, it is known as reticular veins. And if it is more than 3 mm, then it is known as varicose veins. Talking about the etiopathogenesis, first you need to know that the veins have valves normally which prevent the backflow of blood. Now, if I talk about the pathogenesis, these valves are affected in any way, be it becoming weak or undergoing destruction. It causes backflow of the blood, and that leads to filling up of the veins and making them dilated, and then you suffer from varicose veins. Now, if I talk about the etiology in brief, what happens to the valves? They can either be absent due to some congenital cause. They may become weak. The most common cause for being weak is prolonged standing, or in some cases they may undergo destruction, for instance due to any trauma. So this was in brief the etiopathogenesis. If I talk about the clinical features, then the patient may complain of pain, and he or she may define this pain as dull aching. You may see the dilated veins, as you can see in this diagram. One peculiar thing is that there may be edema, and that would give a specific appearance known as the inverted champagne bottle appearance. As you can see in this diagram, this leg due to edema looks like this inverted champagne bottle. Now, there is a specific classification for varicose veins known as the CEAP classification. C stands for clinical, E stands for etiological, A stands for anatomical, and P stands for pathological. If I talk about clinical, then we have the classification from C0 to C6. C0 means that the patient is asymptomatic. C1 means that either there is telangiectasia or there are reticular veins, which I've already discussed above. C2 means that there is a varicose vein. C3 means edema, that also I have discussed above. Now C4 can be divided into A and B. In C4A we have hyperpigmentation. In C4B, we have something known as lipodermatosclerosis. There is also C4C, wherein we have coronaflagellation. In C5, we have a venous ulcer, which is actually a healed venous ulcer. And in C6, again we have a venous ulcer, but this time it is an active venous ulcer. So this was the CEAP classification, wherein I discussed about the clinical. Next, what we have is the etiological classification, wherein first what we have is EC, which stands for congenital cause. P stands for primary varicose veins. S stands for secondary varicose veins, which means it has occurred due to some disease. And then we have N, wherein there is no etiology identified. Now next, if I talk about the anatomical classification, then here we have AS, which means the superficial veins are involved. AD means that the deep veins are involved. AP means that the perforators are involved. And N stands for no anatomical region identified. If I talk about the pathological classification, then here we have PO, which stands for obstruction, PR, which stands for reflex, PRO means that there are both reflex and obstruction, and PN means that no pathophysiology identified. This is the CEAP classification. Also, we have some clinical tests for identifying varicose veins. One of them is the Trendelenburg test. The full name is Trendelenburg test. Here, what we do is we ask the patient to lie in supine position, after which we empty the vein. After emptying the vein, we tie a tourniquet at the saphenofemoral junction. After tying that, we ask the patient to stand, and then we release the tourniquet. Once the tourniquet is released, there can be two conditions. First, condition is where the vein fills from above downwards. And if this is the case, then it means that the saphenofemoral junction is incompetent. In the second case, the vein fills from below upwards. And if this is the case, then it means that the perforators are incompetent. We have many more tests for identifying varicose veins. Now next, if I talk about the investigations, we can go for a venous Doppler. Now, if I talk about the treatment of varicose veins, then treatment involves first what we have are normal things such as you avoid prolonged standing. We may also go for limb elevation, as you can see in the diagram, and we have some special compression stockings which can be used in varicose veins. Even after the conservative management, if there is no improvement, we may go for surgeries. These surgeries can be open surgeries or they can be minimally invasive surgeries, which includes surgeries like sclerotherapy, or you can also go for endovascular ablation therapy. So this was all about varicose veins in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video and subscribe to my channel.